A little bit about critical access hospitals. It was created, the critical access designation was created in 1997. It was, in fact, a safety net for the really small rural hospitals. It was designed to keep them open because they did provide a critical component out there. They did provide care in their very rural areas. The initial bed size was much reduced. It was about 15 beds actually, as opposed to 25. So the early converters, by 2000, there was 170 critical access hospitals in the United States. After that time, they changed the legislation to try to make the net a little wider to capture more hospitals that also needed the financial help, I guess you could say, the financial support that critical access provided. And as a result of that, in 2007, there's 1,271 critical access hospitals in the United States. So as you can see, there's a significant growth to them. And again, they were resized to allow the 25 bed limit, but also it does provide, in the sense, a safety net, a financial safety net for hospitals. Jamestown Hospital is one of the last ones in North Dakota to convert. Devils Lake has converted. Williston, Dickinson are all in the process too. So Jamestown is one of the last ones to convert. Some of the financing options that we're looking at with the new facility, it's been kind of a wild ride here lately with everything that's happened to the stock market and the access to capital financing. But we're really looking hard at leveraging the corporate programs that are out there, the government programs that are out there. Predominantly the USDA looks like it's going to be a big component of it. We do qualify for the USDA for the rural programs because we're in a community of less than 50,000. So they have some programs that will fit pretty well with us. We will be injecting some cash from the operations thanks to the good stewardship of past administration, board members, and foundation. We are able to do that. We will be doing some public fundraising as well. But this will, keep in mind, this will not be an important point. The hospital project is not a taxpayer funded issue. So that's an important point that we wanted to make. A little bit about the design work that we've done so far. This is out along I-94, would be running along the top here. Excuse me, the viewpoint from the vantage point from above, you can see the hospital design, and again, this is still conceptual. You can see the access road is not illustrated here, but it would be dropping down off 94 to the south and then would cut over. And you can see the hospital, the MOB, which is medical office building. It's a medical term for clinics. That's where they would be located. And then the administrative part of the hospital would be over here. The main patient care areas are right through the hub. You can see the parking, and that's one thing we're direly short of here in our current location. We're sizing it for 205 parking spots for the medical office building, assuming that the clinics all came with. Visitor parking for the hospital would be 120 spots. Staff parking about 90. We would have a service entrance on the side here where semis would come and unload all of the materials and other types of things we use here. The emergency room would be around be on the front side of the hospital, which is the I-94 side, and there'd be a drive-through emergency room drop-off, actually a double bay for ambulances and other folks to come into when it's inclement weather. And then there would be parking for patients and family on the emergency room on the back side. And there's another 50 parking spots over here. And we have created, since we have such a large footprint, this is 50 acres, and we have an option on another 30 that's the perimeter of the property. We do have the opportunity to do expansion for the MOB here, and we have future site development. You can see the dots here, here, and here. So we're looking, as Cindy mentioned earlier, trying to create the medical campus environment, having everything in one location, and hopefully drawing other providers and other medical businesses out there as well. The hospital is actually going to be slanted slightly to the northeast. It's going to be facing the city of Jamestown proper. And there are some actually storm ponds out there right now, so there's some challenges, but I think the architects have done a wonderful job and Interstate Engineering of helping us to design with the challenges in the current terrain. This is I guess a projected view of what the hospital would look like. If you're traveling west on I-94, this is what you would see. You can see the slope coming down here. On the left side is the administrative wing of the hospital. In the middle part is the hospital proper, which has all of the ancillaries and surgical and ER on the first floor. and all the patient beds would be on the upper floor. And on the far right, you'll see this in the lower picture, that's where the medical office building or clinics would be, and this would be the double drive-through ambulance doors. And this big glass open area, that's that 3-story, that would be the dining area, and it's kind of the centerpiece of the building, and it draws in the natural light and would be quite visible from I-94. This is a close-up of the same image, and again you can see the glassed-in dining area, and we'll actually show some indoor pictures of this here in a second. One of the fortunate things we're able to do because of the slope and the terrain, a lot of the lower levels of the building will now have actual natural lighting through windows. We're able to create that because of the slope. This is actually on the west side of the building now, looking back. This in the foreground is the medical office building or clinics. They're connected to the hospital through this adjacency, and then some of the ancillary testing is here on the lower level, and then the hospital proper. Then as you draw the image in closer, you can see the emergency room with the double drive-through doors. Patient drop-off would be in this area as well. And this is important. This would be facing I-94, and the emergency room would be well lit 24 hours a day. The emergency room lights would be on. I guess anybody traveling by is going to be very clear that this is a hospital. Looking from the south, now looking to the northeast, this is the main, I'll start with the lower picture. This is the main drop-off point of the hospital, and again you can see the hospital the main portion of the building is right here. All the patient beds are on the upper floor. The MOB or clinic would be on your left side, and then the administrative wing would be here. Currently the architects have designed in what's called a healing garden or landscape effect. And there would be actually waiting areas, alcoves. You can see the 3 of them here. They'd be waiting areas for the laboratory, for radiology, and for surgery. And patients, after they're registered through the front door, would be instructed to go into one of those 3 areas to wait. Or they could also, family members could go down to the cafeteria and wait. But it's a much different effect right now. We have a real issue with privacy in the hospital, and that everything comes through the front door. The registrations is there. And then we've got one big waiting area that we really can't protect people's privacy to the extent we'd like to. Cindy, did you want to talk this?
And then again, just remember that these drawings change every month when the architects come. So what you see there, they just get better though, but they're not exactly the same. And this is just showing you, and we'll just kind of quickly go through these so we can have some discussion yet. Is just again when you walk in, and you'd be walking in from here, and we see there being kind of an admission area, and we're still kind of working out so people don't have to travel such distances. And also if you came from the medical office building, how would you come to have that x-ray and register? And so we're doing a lot of wayfinding and planning on how are these things, and also looking at changing our processes, because that's another reason of why we want to do this, is because it can help us to be able to change some of our processes. And again, this just shows you, this is one of those little bump out areas that Alan was talking about, where we could also have some registration. We envision maybe that you come in and you go register in radiology and lab for your procedure, and then sit there without having everybody register at the same desk. So there are a few other. And this again is just showing you when we was talking about that glass area. Rather than have an enclosed, our dining room now is an enclosed room. It's just a room. They just use a lot of the common space for also public space. So the trend is that you put your dining and have your dining area right in your public space, and then also a little patio out so that people could sit outside if they'd like to also.